This video showcases the procedure of trocar-assisted iridodialysis repair along with reverse flow-through pupilloplasty. So as you see here, there is a traumatic iridodialysis. This is a pseudophakic patient. Anterior chamber trocar is placed here, and I'm just trying to ensure that there is no vitreous in the anterior chamber, as it was a traumatic case, taking care not to involve any amount of iris tissue into the vitrectomy probe. But luckily, there is no vitreous in the anterior chamber. Now what is seen is that conjunctival peritomy is done, and the scleral groove is being made along the entire peripheral circumference of the amount of the iridodialysis. So now I'm trying to inject OVD inside the eye and trying to flatten out the iris tissue, because this is very important to flatten out the iris tissue so that the iris tissue is flat when you're trying to engage it into the tip of the needle. Now this is what you see is the trocar which is being placed. I have removed the fluid infusion from the trocar, and I'm going to use the same trocar to do the iridodialysis. So this is the 9-polypropylene suture that was passed through the trocar, and it engaged the peripheral iris tissue and is withdrawn from the scleral groove. Similarly, this is actually a double arm suture, and now what I'm doing here is that the needle is again passed through the trocar, which now engages the adjacent tissue to the previous one. And having done that, both the suture ends are pulled, and you can see here that how beautifully the iris tissue comes along with the suture. So once you get it there, you just tie up the suture knot into the groove, and the knot, it actually goes into the groove. Again, you go ahead through the trocar. The beautiful description here of the trocar is that it can swivel around the entire area of the iridodialysis. So that's an important aspect. And the second important aspect of using this is that it does not engage any amount of corneal fibers into it. So this completely makes the iridodialysis repair very simple and easy. Otherwise, even if a minimal amount of corneal fiber is involved into the tip of the needle, the suture does not slide into the position that is needed. So here you see that the iridodialysis repair is performed completely, and the iris is completely fixed to the base. But we again have correctopia here. I'm trying to do this, trying to correct the correctopia. The procedure that I'm doing here is the reverse flow-through pupilloplasty procedure. But for the beginners, I would recommend that this technique requires a lot of surgical expertise to do. Maybe single pass flow-through might be easier for people who are just venturing into doing a pupilloplasty, but once you are well versed with that, you can even do the reverse flow-through. The concept of having a reverse flow-through is that you do not get any suture knot into the anterior chamber. You get it behind the iris tissue, so it looks probably like a cosmetic surgery that is done for the patient. The entire concept of reverse flow-through is the same as the single pass flow-through, but the only thing is that the needle, it pierces the iris tissue from behind, from both the sides, and that is what it leads to the formation of the knot on the posterior aspect. Another thing that I would like to say in this video is that you need the micro scissors to cut the suture needle. So once you have done that, you can do, in this case, IA is being done and it is reposited. And this is how the patient looks into the pre-op and the post-op period, and the patient did very well.